Hi, I'm Sarah Pierce, and this is my Nursing 335 Clinical Reflection video. Over the course of the semester, we assigned ourselves to different clinical experiences within different categories such as advanced practice, nurse supervisor, peer leadership, independent hours, political day, and more. It was very different and a good experience to be able to select the different opportunities you wanted to participate in to get your clinical hours. I enjoyed seeing different areas of nursing that I haven't seen before. It gives you a completely different perspective on nursing as a whole rather than just the inpatient that we normally see. The purpose of this video is to go over the 8 objectives and how I met them over the course of the semester. The first clinical objective is to utilize previous knowledge of the sciences, liberal arts, information technologies, and nursing to develop skills as a nurse leader. I completed this by different peer leadership labs that I participated in. I did a 309 care map where I aided 309 students in completing their first care map, which I used previous knowledge from when I was in 309 and 321 and 320 different classes that I've done care maps on, and use my knowledge to aid them and guide them in the right direction, help them fix their diagnoses and what direction they should go in. I also completed a 311 vital signs workshop and helped the 311 students work with blood pressure, heart rate, respiration rate, temperature, and help them practice their skills and become more efficient. I also did a 309 first prep, which was exciting to see, and it makes you realize how much you've grown seeing how you were when you were in 309 to now. And I helped them focus their prep, help them find what they were looking for, because when you're not used to the system, it is overwhelming and it is hard to find the right information to get. I helped them find information, sort through the information, what they needed to know, what was not as important for their prep. I helped them create nursing diagnoses based on their patients. And then I also participated in that same clinical group's first clinical day on the unit for their first bath and helped them learn how to speak to patients, how to go about doing a bath since they were very nervous. They've never done it on a real patient, and I remember what it's like to do that, so it was enjoyable to help them. The objective number 2 was to apply basic principles of ethics and management to meet the challenge of an ever-changing healthcare environment. I completed this when I did my advanced practice. I shadowed 2 trauma nurses in the Tower Health emergency department. The trauma nurses, when there's not a trauma, they follow the emergency department and they aid the ER nurses with patients coming in. I saw an MI, a GI bleed that resulted fatally. I did see traumas come in, a car accident, which was really exciting to see how they work together, the communication, the leadership involved in being that kind of nurse. I've never experienced that before, and it was a great experience. I also completed this objective with my nursing supervisor. When I got there, the nursing supervisor was dealing with a situation with a patient with dementia who stated that their spouse abused them, and the subjective and objective information didn't lead to that. There were no signs of any of that, but legally and the ethics involved, the nursing supervisor had to deal with the situation, which ended up they removed the spouse from the patient's room and they were not allowed to come back and see the patient. This was a very hard thing for the nursing supervisor to deal with, and they definitely needed management and leadership roles to be able to handle the situation. I know it was very hard for them to deal with because it's a touchy subject. And then objective 3 was developing or demonstrating leadership skills through effective use of communication by representing self, the college, and the nursing in a professional manner. I completed this by emailing and confirming the date and time with each of my clinical shadowing experiences. I emailed them and asked what was expected, if they needed me to bring anything, what I needed to do to prepare for the shadow experience. I also sent emails thanking each of them for the experience, what I enjoyed, what I had learned. They were all very good experiences and I enjoyed them all. And then objective 4 is to critically evaluate and disseminate current research related to the principles of leadership and the effect on the healthcare system. I researched an article and I will be presenting it during post-conference, regarding the misconceptions and myths regarding fundamentals of care and how it's thought to be the misconception that it's just common sense, which it's not. There's more that goes to fundamentals of care than common sense. From what I've read in the article, it's a very common misconception in students, but I will be presenting that in post-conference. Objective number 5 is to function as a competent patient advocate, nurse advocate, and change agent. I completed this with my interprofessional experience. I went to Luther Crest. I sat in on meetings regarding patient care. They dissected each patient, talked about what their needs were specifically, what they need to improve on before they can be discharged, what they all need, how they're doing, and so on. I also sat in a meeting with nurses, specifically the director of nurses, and how to improve their staffing since they're very low staff, how to get the RNs and LPNs to complete their job duty requirements, which is seeming to be difficult at the time, and how they should work about this issue, which seemed frustrating for them, but by the time I left, they seemed to be going in the right direction on what they needed to be doing. I also completed this by the prison. I accompanied the LPN on MedPass, and when an inmate came up and asked why they were taking it, a reason why they were taking it, why they weren't taking it, what it was doing, the LPN explained to them about the situation. I also participated in sick call watched the nurse evaluate the inmates when they came in, find out what was wrong. There was one patient who came in who had missed their morning med pass, who had a blood pressure medication to take. They didn't take it because they were sleeping, and they came in, their blood pressure was 200s over 100s, which is extremely high. So they immediately gave them the blood pressure medication and kept them there to evaluate to see if it would come down. It did come down. They do have another medical condition, which I don't remember at the time, that makes that more of an issue. But then they discussed with the patient why it's important to get medication in the morning and don't sleep through it, and that you need to take it on a regular basis. Objective number 6 is to formulate plans for continued personal leadership growth and development as an independent practitioner of nursing and contributing member of society. I completed this by peer leadership roles. By the 309 first bath, I was in mental health clinical. I was able to fine-tune my nursing skills and pass on information I had learned to be able to convey what I know and what I've learned, especially in previous classes that they haven't taken yet, 321, 320, and help them grow and learn from what I've learned and help them in their future classes. I also attended the SNA Dine and Discuss. We saw a pediatric oncology nurse, a CRNA, and a member from Turning Point, which helps domestic violence victims. It was really interesting to see different career options for nurses, what different areas of nursing look like, what it looks like when you advance your nursing degree, like the CRNA. It was very interesting to learn about their roles and their leadership and how they go about doing their job and furthering their education. I also did this with my service leadership hours. I participated at the Humane Society of Lehigh County. It worked independently. It was all based on when I could go, when I wanted to do hours. I worked alone. I completed my tasks. That helps with leadership and growth, to be able to do your tasks on your own. So I cleaned large cat rooms, I fed kittens, I walked dogs, I mopped floors. But it was good for the growth of me as an individual. Objective number 7 is to recognize the role of the nurse in policy making related to healthcare services at local, state, national, and global levels. I completed this objective when we went to Harrisburg for our political Capitol Hill Day. I relearned how a bill's passed, which is not an easy concept, and how many bills are normally introduced and how many are passed, which is very few are passed compared to what is introduced. So it's a hard process. Many bills get shut down even if they're good. It's a very long, grueling process. Specifically, one that relates was the nurse practitioner that they're trying to pass, to where nurse practitioners do not have to work under a physician. They can work on their own, which I think is great, moving in the right direction. Other bills can also affect healthcare workers and nurses. Anything dealing with health insurance and care affect our job and what we do. And then objective number 8, predict and describe potential ethical dilemmas within clinical, organizational, and professional nursing practice. I completed this when I researched my ethical article for post-conference that I will be discussing during post-conference. The article that I found was the ethical dilemma regarding putting cameras in nursing homes for patients. This was introduced to prevent abuse and mistreatment from occurring within nursing homes, since there's many stories going around that I've seen. I'm sure many other people have seen the stories of abuse that happens. This was to prevent that by having cameras in, but there's also the ethical debate that putting a camera in a patient's room is an invasion of their privacy. I know family members, in the article it discusses family members like the idea of having cameras in the room to protect their loved ones, but it is also an invasion of privacy, so there is a huge ethical debate there. This is how I met all of my clinical objectives, and I hope you enjoyed watching. Thank you.